Branches of psychology. Cognitive psychology. It investigates mental process involved in acquisition, storage, manipulation, and transformation of information received from the environment along with its use and communication. The cognitive processes are attention, memory, reasoning, problem solving, perception, etc. Biological psychology. Biological psychology focuses on the relationship between behavior and physical system, including the brain and the rest of nervous system, immune system, and genetic, etc. Behavior refers to the monitor our behavior or perceptual, etc. Next is neuropsychology. Neuropsychology has emerged as a field of research where psychologists and neuroscientists work together. Neuroscientist studies the brain and the role of neuroscientists or chemical substances which are responsible for neural communication in different areas of brain and in mental functions. Neuroscientists research on people with normal functioning brain as well as on people with damaged brain like EEG, PET, fMRI, etc. Developmental psychology. It studies the physical, social and psychological changes that occurs at different ages and stages over a lifespan from conception to old age. The primary concern of development psychologists is how we become and what we are. This topic is totally based on the development of human beings from birth to the old age. Psychologists focus on the biological, social culture, environmental factors and that influence psychological characteristics such as intelligence, cognition, emotion, temperament, morality, etc. Developmental psychologists collaborate with anthropologists, educationalists, neurologists, social workers, counselors, etc. Concern for growth and development of human beings. Social psychology. Social psychology is the study of how individual is influenced by the presence and the behavior of others. It explores how people are affected by their social environment, how people think about and influence others. Social psychologists are interested in such topics as attitudes, conformity, and obedience to authority, interpersonal attraction, etc. And also helpful behavior and prejudice, aggression, social motivation, intergroup relation, and so on. The cross-cultural and cultural psychology is the study of similarity and differences in behavior among individuals who developed in different cultures. It includes how people think, feel, act, and respond to the culture and other peoples. It also examines the role of culture in understanding behavior, thought, and emotions. It assumes that of it assumes that human behavior is not only a reflection of human biological potential but also a product of culture. Environmental psychology. It studies the interaction of physical factors such as temperature, humidity, pollution, and natural disaster on human behavior. The influence of physical arrangement of the workplace on health, emotional state, and the interpersonal relation are also investigated. Disposal of waste, population explosion, conservation of energy, efficient use of community resources are associated with and are function of human behavior.
Health psychology. Health psychology is the study of psychological and behavioral process in health, like illness, healthcare, stress, and anxiety.
Clinical and counseling psychology. It deals with causes, treatment, and prevention of different type of psychological disorders such as anxiety, depression, eating disorder, and chronic substance abuse. The first is counseling, which aims is to improve everyday functioning by helping people solve problems in daily living and cope more effectively with challenging situations. Second, the work of clinical psychologist does not differ from that of counseling psychologist, although a counseling psychologist sometimes deals with people who have less serious problems. In many instances, counseling psychologists work with students, advising them about personal problems and career planning. Like clinical psychologists, psychiatrists also study the causes, treatment, and prevention of psychological disorders. A clinical psychologist has a degree in psychology which includes intensive training in treating people with psychological disorders. In contrast, psychiatrist has a medical degree with year of specialized training in the treatment of psychological disorder. The psychiatrist can prescribe medication and give electroshock treatment, whereas clinical psychologist cannot. The next is educational psychology. Educational psychology studies how people of all ages learn. Educational psychologists primarily help develop instructional method and material used to train people in both educational and work setting. They are also concerned with research on issues of relevance for education, counseling, and learning problems. A related field is school psychology, focus on designing programs that promote intellectual, social, and emotional development of children, including those with special needs, and they try to apply knowledge of psychology in a school setting.